Hello everyone, I am Dr. Ziyad. Welcome to the AAPC CPC mock exam 2. In this mock exam, we will go through all 100 multiple choice questions organized by chapter, just like the real CPC exam. I will explain you how to find the answers easily and quickly. So make sure to subscribe my channel and check out my playlist.
Mock Exam 2, Chapter 8, CPT 20,000 code series that include Musculoskeletal System. Question number 1. A patient with a congenital maxillary hypoplasia and midface deformity undergoes leaford eye osteotomy for reconstruction. During the procedure, the surgeon performs a leaford eye advancement and reconstruction of the midface, including two-piece segmental osteotomies of the maxilla with bone grafting to reposition the dental arch and restore facial symmetry. What is the correct CPT code to report this procedure? So there are 4 answers available. Take your CPT code book and find the answer. So here you have to highlight this is maxillary hypoplasia and midface deformity. Leaford 1 osteotomy for reconstruction is used. So reconstruction of the midface with two-piece osteotomies with bone grafting. So these are things you have to highlight. When you look at the answer, all answers are adjacent. So for the quick answer in the exam, you can use the elimination method and directly go for the course. But for the real working scenario, you have to use the CPT Alphabetic Index. So I will explain the both methods. So when you go to the code, 21,141 is reconstruction midface, leaford 1, single piece segment movement in any direction without bone graft. In our case, 2 pieces with bone grafting. So this is not suitable answer. 42 also 2 pieces but without bone graft. So this is not suitable answer. 45 is single piece. 21,146 is 2 pieces segment movement in any direction requiring bone graft, includes obtaining autografts, ungrafted unilateral alveolar cleft. So this is the correct code explaining the scenario. So leaford osteotomy, 2 pieces with bone grafting. So the correct answer is answer D. If you encounter this scenario in a real working world, you have to use the CPT Alphabetic Index. When you go to the CPT Alphabetic Index, first you have to search for the main term reconstruction. Here you can see this is the facial reconstruction. So the main search term is reconstruction. So we go to the index and go for the main term reconstruction. There you have to go to the subterms midface. Here you can see with bone graft, without bone graft, forehead advancement. There are 3 subtopics available. So in our case, this is with bone graft. So it will redirect you to the following code series. Again, go back to the tabular list and confirm the answer. Once you confirm the answer, the correct answer will be answer D. Question number 2. A patient is diagnosed with compression fractures of the L2, L3 and L4 vertebrae. The patient agrees to have kyphoplasty. A balloon catheter is inserted in the vertebrae and inflated, restoring the height of the vertebrae. Bone cement is injected in the vertebral space until the whole L4 body is filled. The same procedure is performed on the L2 and L3 levels. The procedure performed bilaterally on the 3 vertebrae. What CPT coding is reported? So there are 4 answers available. Take your CPT code book and find the answer. Okay, here you have to highlight this is compression fractures of the L2, L3 and L4 vertebrae. Procedure done is kyphoplasty using balloon catheter, and the procedure is performed in all the L2, L3 and L4 vertebrae and done bilaterally. Here also you can see the codes are use adjacent codes, so you can use the elimination method to find the answer. I also explained the alphabetic method also. So when you go to the code 22,513, it says percutaneous vertebral augmentation including cavity creation, fracture reduction and bone biopsy included when performed using mechanical device. Example, kyphoplasty, 1 vertebral body, unilateral or bilateral cannulation, inclusive of imaging guidance, thoracic. So up to now, it's a common description for all 3 codes. This is for the thoracic. So here you can see vertebral augmentation, that is called the kyphoplasty. So the procedure is kyphoplasty, cannulation used bilaterally. So this says for thoracic. In our case, L2, L3, L4, that is lumbar vertebra. So this thoracic one is not suitable. Let's go to the next code, lumbar. So lumbar is suitable. And when you see the add-on code 22,515, that says each additional thoracic or lumbar vertebral body list separately in addition to the code for the primary procedure. So in our case, we have done the kyphoplasty for 3 lumbar vertebrae, L2, L3, L4. So for the first one, you have to use this code, that is 22,514. For the next one, you have to use the 22,515. And the third one, you have to multiply by 2. So the correct answer will be this one, 22,514 and 22,515 into 2. Here you may confuse whether to use the modifier for bilateral procedure. That means the answer C. But read carefully, in the code description it says this code is for unilateral or bilateral cannulation. So all these things, this code includes the unilateral or bilateral both. So the correct answer will be answer B. So here no need for the modifier. If you encounter this case in a real working scenario, you have to use the CPT Alphabetic Index. So in the CPT Alphabetic Index, you can directly go to the index term Kyphoplasty. It will lead you to the code series 22,513 to 515. Again, go back to the tabular list and confirm the answer. Once you confirm, the correct answer will be answer B. Question number 3. It's a tricky question. I obtained this question from the CPT guidebook. So without looking answer, if you find the answer for this question, you are ready to take the real exam. The question is, a 50-year-old presses to the operating room with the right index trigger finger and left shoulder bursitis. The left shoulder is injected with 1 cc of silocaine, 1 cc of celestone, and 1 cc of marcaine. An incision was made over the A1 pulley in the right distal transverse palmar crease, about an inch in length. This is taken through skin and subcutaneous tissue. The A1 pulley is identified, released in its entirety. The wound is irrigated with antibiotic saline solution. The subcutaneous tissue is injected with marcaine without epinephrine. The skin is closed with 4-knot ethylone suture. Clean dressing is applied. What are the codes for these procedures? So there are 4 answers available. Take your CPT code and find the answer. If you are able to find the answer, you are competent to take the real exam. So here you have to highlight there are 2 procedures actually. One is for the right index trigger finger and other one for the left shoulder bursitis. For the left shoulder bursitis, the injection is given. You can see the injection is given. And for this trigger finger, incision was made over the A1 pulley. A1 pulley is identified and released its entirety. So there are 2 procedures. So you have to find the codes for both. So let's find the code for the right trigger finger. So here also you can use the elimination method to find the answer quickly in the exam purpose. But in the real working world, you have to use the alphabetic index. So I will explain both. Let's find the code for the right index trigger finger release. So when you go to the code, 20,552 is injection, single or multiple trigger points. 553 is single or multiple trigger points, 3 or more muscles. 26,055 is tendon sheath incision. But read carefully, you may confuse here. There are incision and injection. So which one given incision and which one given injection, you have to read carefully. So for the right index trigger finger, you can see the first thing, the left shoulder is injected. So for the left shoulder bursitis, injection is given. But for the right index trigger finger, incision was made. So incision here. So when you look at the answer, 552 and 53 is injections. First one is single, second one is multiple. But 26,055 is tendon sheath. So to relieve the right index trigger finger, incision is made. So for the incision, you have to give the answer 26,055. And regarding the modifier, but in this answer, there's no confusion because only one modifier is used, that is F6. So when you go to the cover page of the CPT codebook, you can see the modifiers. So there are modifiers for the eyelids and the fingers. So here, right index finger. Index finger means second finger because thumb is the first finger and the index is the second finger. So here you have to go, this is right side. So F series, you can see, first it comes from left side, then right. F5 is right hand thumb. F6 right hand second digit. The second digit is the index finger. So F6 is the correct code, but all 4 answers having the same code, so there's no confusion. So in this case, you can select A and C. So you can eliminate this B and D with the first procedure. So let's check the code for the second procedure. So the second procedure, you can see The answer given here is to A and C we have selected. So A is 20,610. That is arthrocentesis, aspiration or injection, major joint or bursa, example shoulder, hip, knee, subacromial bursa without ultrasound guidance. So in this case, there's nowhere mentioned regarding the ultrasound guidance. So we have to take it as without ultrasound guidance. And the place of injection is left shoulder. So here the injection given is shoulder. So shoulder is included here. So the correct code will be 20,610. Then you have to think about the modifier. So in this case, there are two procedures done. One for the trigger finger, other one for the left shoulder. So two procedures, different anatomical locations. So you have to use the modifier 51 for the multiple procedures. So the correct answer is answer C. So if you encounter this case in a real working scenario, you had to use the CPT Alphabetic Index. So in the CPT Alphabetic Index, you can directly find the code for the trigger finger. That is trigger finger repair. Only one code it will mention, that is 26,055. You can go back to the tabular list and confirm the answer. So that is the code for the trigger finger. The injection, you have to go to the main term injection, then go for the subterm joint. So there are codes available. Again, you have to come back to the tabular list and confirm the answer. Once you confirm, the correct code will be 20,610. So the correct answer is answer C. Question number 4. A patient's left eye is damaged beyond repair due to a work injury. The provider fabricates a prosthesis from silicone materials and makes modifications to restore the patient's cosmetic appearance. What CPT code is reported? So there are 4 codes available. Take your CPT code book and find the answer. So here you have to highlight the left eye is damaged and prosthesis from silicone material is inserted. So when you look at the answer, 21,000 adjustment codes are used. So you can use the elimination method for the exam purpose. So let's go to the codes. So once you go to the code, 21,076 is impression and custom preparation, surgical obturator prosthesis, orbital prosthesis. So the 76 is obturator prosthesis, 21,077 is orbital prosthesis. So in our case, the prosthesis is for left eye. Eye means orbital. So eye we can call as orbital. So orbital prosthesis is the correct. So 21,077 is the correct answer. When you look at other answer, 21,008 is definitive obturator prosthesis, that is not suitable. And 21,086 is auricular prosthesis. Auricular means the ear. Orbital means the eye. So the correct answer will be answer D. So if you encounter this case in a real working world, you had to use the alphabetic index. So when you go to the alphabetic index, there you had to search for the term orbital prosthesis. It will lead you to the code this one. So if you search with the main term prosthesis, then you had to search for the subterms, but it will little bit difficult. Here I had to highlight another thing. When you read the code description on the top, it says codes 21,076 to 89 should only be used when the physician or the other qualified healthcare professional actually designs and prepares the prosthesis. In this case, you can see the provider fabricates the prosthesis from silicone material and makes modification to restore the patient's cosmetic appearance. So the code is correctly matching here. Question number 5. In each CPT code series question, you may expect one ICD-10-CM code as well. So this question is such type. So here, a patient presents to their primary care physician to management of degenerative osteoarthritis in the right wrist. The physician performs an injection of 1 milligram Sinovac into the right wrist joint. What CPT and ICD-10-CM codes are reported for this encounter? So there are 4 answers available. Take your CPT and ICD-10-CM code books and find the answer. So here you have to highlight this is degenerative osteoarthritis in the right wrist, injection given on the right wrist. So you can use the elimination method as their adjacent codes are used here. So let's find out the CPT code first. So when you go to the code series, 20,550 is injection single tendon sheath or ligament aponeurosis plantar fascia. 551 is single tendon origin or insertion. 526 is injection therapeutic. Example, local anesthetic corticosteroids for carpal tunnel. 605 is arthrocentesis aspiration or injection immediate joint or bursa. Example, temporomandibular, acromioclavicular, wrist, elbow or ankle without ultrasound guidance. 606 is with ultrasound guidance. So in this case, you can see degenerative osteoarthritis, physician performance injection into the right wrist joint. So right wrist joint injection. So the correct code will be 605. You can see the wrist joint also mentioned in the description as well. So 605 will be correct answer for the CPT code. So when you look at the answers, the 605 is only used in answer C. So you can directly go for the answer, but better to confirm with the ICD 10 cm code as well. So let's find the ICD 10 cm code. So when you go to the code M19.23, that is secondary osteoarthritis wrist. But in our case, you can see the osteoarthritis mentioned as the degenerative. Degenerative one is the primary. If you are confused with that, for using secondary code, it should be mentioned as a secondary. Otherwise, you can go for the primary. So when you go other code, M19.03 is primary osteoarthritis wrist, and the subcode is primary osteoarthritis right wrist. So in our case, right wrist or primary osteoarthritis. So the correct code will be M19.031. So the correct answer will be answer C. So if you encounter this case in a real working scenario, you have to use the alphabetic index of CPT and ICD 10 cm to find the answers. So let's see how to find that. So for the CPT alphabetic index, first you have to go for the search term injection, then go to the subterm joint. So it will lead you to the following code series. Again, come back to the tabular list and confirm the answers. Once you confirm, it will be answer 20,605. In the ICD 10 cm alphabetic index, first you have to go search for the main term osteoarthritis, then go for the subterm wrist, then go for the subterm primary. It will lead you to the code M19.03. Again, come back to the tabular list and confirm. Once you confirm, the correct code will be M19.031. So the correct answer will be answer C. Question number 6. A patient sustained a wrist fracture while hiking and a gauntlet cast was applied by the emergency room physician. 1 month later, the patient visits their primary care provider to have the cast removed. What CPT code is reported by the primary care provider? So there are 4 answers available. Take your CPT code book and find the answer. So here you have to highlight this is a wrist fracture and cast was applied by the emergency room physician and the primary care provider removed the cast. The question here is the code for the primary care provider. So don't mess up with the emergency room physician's procedure. So when you look at the answer, all answers are adjacent codes. So you can use the elimination method to find the answer in the exam. So once you go to the codes, so code 29,700 is removal or bivaling of gauntlet, boot or body cast. 209,705 is full arm or full leg cast. In our case, it's a gauntlet cast. You can see it's a gauntlet cast. Gauntlet cast means the cast applied for the wrist, like glove cast application. It's called the gauntlet cast. So that will be the correct coding here. So the correct answer will be answer B. So if you encounter this case in a real working scenario, you had to use the CPT alphabetic index. So in the CPT alphabetic index, first you have to search for the main term here, cast removal. So go to the main term removal, then go to the subterm cast. So it will lead you to the following 3 codes. Again, come back to the tabular list and confirm the answer. Once you confirm the answer, the correct answer will be answer B.
So if you are preparing for the AAPC CPC examination, my channel will help you to solve the problems you are facing in your examination preparation. So please subscribe my channel, and if you have any doubts or any questions, you can put in the comment section, or else you can email me, or you can WhatsApp me to the email and the WhatsApp number displayed here. So please subscribe my channel and stay with me. Thank you.